today we're talking about one of my favorite topics in the injectable industry, certainly in the aesthetic injectable industry, and that is biostimulators. Well, welcome everyone back. This is the next episode of the Beauty in Bloom podcast. I'm Jason Bloom, facial plastic surgeon in the Bryn Mawr, Pennsylvania area, right outside of Philadelphia. And I'm joined today, as always, by our wonderful nurse injectors. We have Lily Marquez, Sarah Houtchins, and Simon Talmore. Hi, guys. Good to see you.
Hi.
See you.
It's awesome to have you guys back. And today we're talking about one of my favorite topics in the injectable industry, certainly in the aesthetic injectable industry, and that is biostimulators. This is super hot right now for a number of different reasons, but biostimulators I've been using personally in my aesthetic injectable practice since about 2010. And the one we most commonly use in our office is PLLA, poly-L-lactic acid, known as Sculptra. So we'll talk a little bit about this, and I'll talk to each of you guys, and we'll discuss how we use them, in what scenarios, situations where we wouldn't use them, why we like them or not, and we'll go from there. So,
All right.
with that, maybe let's start off. Sarah, tell us a little bit about, what is the definition of a biostimulator? What do they do?
So biostimulators basically force you to produce collagen. So they create a low-grade inflammatory response. And from that inflammatory response, your body builds collagen.
Right. So it's interesting because you say inflammatory response. Well, I've been using these from way back. So Sculptra, for example, which is now owned by a company called Galderma, was owned by Sanofi Aventis and actually Dermic, and they've had a bunch of different, that product itself has had a bunch of different parents. And when you said, inflammation, they used to be like, whoa, we're not, I don't know if we'll discuss that. But in effect, that is really what's happening, right? If you actually talk to dermatologists or people that have spent their life studying skin and what happens there, this is a low-grade fibroplasia or a reaction to generate collagen. Now, that is different than how fillers make collagen, right? We know this. And fillers do produce collagen. That was shown in 2003 at the University of Michigan in the dermatology department, Go Blue. John Voorhees was the lead author on that study, the senior author. And what they showed is that when you injected, actually the filler, the HA filler that they used at that time was actually Restylane, original Restylane. And they injected that intradermally. And they showed that if you put the fibroblast, which is the collagen producing cell, on stretch and stretch that out by putting that filler in, and they took biopsies before and after, they showed more collagen was produced, right? But the interesting thing is, how does Sculptra or biostimulators produce collagen, right? We're not injecting those intradermally. We're not injecting them in the dermis. We inject them at other levels. So how does it produce collagen? And I've asked tons of different dermatologists, of which I'm not one. I say I may be one by association, but, and the answer is through inflammation, because if you take biopsies of these areas, you're going to see multinucleated giant cells, you're going to see monocytes, all the things that you see from a foreign body reaction, but this is low grade, right? And so it is a fibroplasia, and Galderma has really embraced that now and said, this is what's happening, and it's not bad. It's a good thing. So that's really how this works. So when you're talking to patients, Lily, how do you explain to them that you have something that's going to build their collagen? How do you talk to patients about this?
I feel like I talk to them the same way I would with non-invasive treatments as well. You explain that it's going to take time. It's not instant gratification like filler, but in the long run, it's going to look a lot more natural. And you can I say you want to restore the natural heart shape to the face. You can inject the temples, the mid face, the lower face, and you kind of explain that it's going to take a little bit, but it's stimulating that inflammatory response. You're going to get the collagen production, and you're naturally going to start seeing volume come back into your face. You're going to start to notice that you look a little bit younger, kind of like you did a couple of years ago. But I have to explain to them that it takes a little bit. You have to have patience. It's not that instant gratification like filler. So you really have to set that expectation that it's going to take a little bit and that your body has to build collagen. And it does take about 5 to 6 months for you to see the optimal results of that.
Yeah, I mean, there's a couple things that I want to, comment on about that, what you said. And so when I'm just talking to patients in the consultation process, and we're talking about the use of biostimulators, it's interesting because I like to use the analogy of this is like your facial rejuvenation 401k, right? You're putting some money or something into, your face now, but for benefit in the future.
Yes.
Right? You're not going to see this like right away. And you can play the stock market, let's say, with some HA filler and do that. But this is for the long-term benefit for your face. And so people tend to resonate with that idea of like facial rejuvenation 401k program.
Yeah.
And you said like the heart shape to your face. And, we inject this product a lot. We'll delve into this a little bit more, but we do inject it a lot more at the periphery, temples, kind of in that submalar area. And one of the queens of Sculptra who taught me a lot over the years is Rebecca Fitzgerald, and she talks a lot about ovalizing the face. And by injecting at the periphery, you can kind of achieve that more oval, heart-shaped facial structure, which is different than what we normally see as we age, where things start to droop. We get a little bit more square to the bottom of the face.
Even triangular.
Yes.
Exactly. It's more kind of pyramidal or triangular.
One thing that I actually want to ask Sarah about, because Sarah, I noticed that you have a lot of younger patients that you inject Sculptra. I see more of a senior population, the population that doesn't want anyone to know that they've had anything done. They are okay with not having that instant gratification. It's the younger generations that I feel like want that instant gratification, and I so desperately want them to believe in that 401k analogy. And how do you do it? Because it's clearly working for you, and I wish that more of my younger patients would believe in it.
I think social media is a good thing and a bad thing because there's a lot of information about Sculptra right now out on social media. And there's the one side where you should never have it if you ever plan on having any kind of facial surgery. And then there's the other side that says basically what Dr. Bloom said, you're investing in your future self. So we know that once we hit 30, we're slowly starting to lose collagen. And I think I've kind of honed in on people who are my age who, are slimmer builds, don't have a lot of fat in their face like me. And why it's important for us to start now as opposed to once we're closer to needing some kind of surgical intervention. So basically, I just kind of cater to people who not only are, 40s, 50s, 60s, but also my age group. And I talk about how much I have gotten out of Sculptra. And I think I've noticed huge changes from it. So it's easy to talk about.
I think your generation is definitely more proactive.
Preventative.
And
sure.
preventative in some of the things they do. So yes, so at like around 30, you start to lose about 1% of your collagen a year. And, that quickly declines over time. And
Just also want to say that we are all proud millennials here.
Yes.
I mean,
not to be confused with
for me, I don't think I'm a millennial.
What year were you born in?
I was born in 1979. I'm a child of the 70s.
That's so crazy to me.
I always think you're my age. Yeah.
We got to get you on the
like
sculpture
I'm
train.
15,
Yeah.
but yeah, I'm 46. So yeah, but I think your generation is definitely more preventative. This idea of rebuilding one's collagen, I think that is something that you guys have really, it resonates with you, and your generation has definitely taken up more than, say, my generation.
And I hate to say that it's trendy, but I feel that a lot of people are trying to go more towards the regenerative medicine and kind of get away from fillers because of the fear mongering with social media as well. So they're coming in saying, hey, I've heard of Sculptra. I know it takes a little bit more time, but I want to go more natural. I feel like I've been seeing that a lot as well.
And I think that's where, and I agree with you, Lily, but I think that's where it comes down to, in the last episode, I mentioned, if you're getting your hair cut and someone comes in with blue spiked hair, you're freaked out. And so when I'm telling someone that they need a couple of syringes in their mid-face for facial balancing, and they're like, oh, I don't want to look unnatural. And I'm like, look at my face. Do I look unnatural?
Yeah.
I have 15 syringes in my face right now. 15.
I didn't know.
And yeah, well, there you go. See, did a good job. And then that actually opens the door to saying, okay, I see what you look like. You look natural. Let's go ahead with the 2 syringes.
Yeah. So tell me, let's talk a little bit, let's kind of go back a little bit and talk a little bit about what are some of the differences between filler biostimulators, what are some of the current biostimulatory products on the market, what do we use most here? Because, we were talking about Sculptra, definitely not the only biostimulator on the market, but probably the best studied, the most used, and certainly most used in our practice. But maybe, Lily, let's start. So tell me a little bit about the differences other than, like HA, like what are some of the areas that you would inject these products in? What's the difference between like a syringe of filler and some biostimulators?
Well, for one thing, you don't put Sculptra in the lips. So if a patient comes in and they want their lips done, if they want that instant gratification, you can always pair fillers with the biostimulators as well. But if a patient comes in and says, hey, I want a little bit of chin projection and I want my lips done and I want a little bit of cheek right now, we can do that along with doing the Sculptra. But there's certain areas you just wouldn't inject a biostimulator in as well.
So like what are some of the areas that you tend to like not inject?
Under eye, the lips, like the 2 main like areas that you wouldn't inject.
Submalar, buccal area.
I mean, so what I say is you don't want to inject it in basically concentric muscle areas.
Yes.
So areas like around the eye, you have the orbicularis oculi, you have the orbicularis oris around the mouth. Those are areas where you're talking, kissing, chewing, smiling, you're, like moving your periocular area. You want to stay away with using the biostimulators in those areas. But, Sarah just mentioned the submalar area. This is a great area for using biostimulatory products, right? Because let's think about the facial skeleton and, and the facial volume, right? Everywhere we tend to inject usually has some kind of bony buttress underneath, right? We're injecting the temples. You have the temporal fossa, the temporal bone here. If we're injecting the midface, we tend to have the maxilla and the zygoma laterally. If we're injecting the nasolabial fold, you have the maxilla. You're injecting the marionette lines, you have the mandible, jawline, the mandible. But what's here?
Nothing.
Right?
There's nothing to tack any
You're
filler to.
basically your dentition, which we know as we age, that tends to go down a little bit. So you could put, in my mind, you could put 4 syringes of filler in this area on one side and not really see it, right? Because there's nothing to push against it and like press against it. So this submalar area, that kind of buccal area, which, as we know, as we age, as we lose weight, which is another topic we'll talk about, this area tends to get very hollow and drawn and gaunt, is a fantastic area when you're injecting subcutaneously with a little bit of biostimulatory product like Sculptra. So Simone, tell me, like, what are some of the biostimulatory products like currently on the market, whether you use them or not?
Yeah, I mean, there's a couple other ones that are on the market. I personally don't use them. It would be Radiesse and Bellafill. In my previous practice, I was trained on Bellafill. Don't love it, so I don't use it. Sarah, I think you use Radiesse every once in a while on the right
Every once in
patient.
a while. Usually on people who have had it before and kind of insist that they like it and they want to stick with it. It's not something that I would introduce as a new product to a patient just because it's not my personal preference. And I have a lot of reasons why I love Sculptra, and there's a lot of clinical data on it. I mean, it just tends to be more consistent, I think.
Yeah, no, I'm a big Sculptra fan, lover of that, and I will openly say it's probably my favorite injectable product. That being said, let's just quickly talk about those two products. So Radiesse is CaHA, which is calcium hydroxyapatite, and it can actually be used in two different manners. I actually like it when we're looking for a lot of definition, particularly in men, cheekbones, jawlines, works great. And when it's injected, we say full strength out of the syringe. And then it also has regenerative properties and collagen stimulating properties. There was an article many years ago by Berlin where they injected Radiesse behind the ear post-auricularly and did biopsies and showed it does produce collagen in the same way that some of these other biostimulators do. I really have not used it in this respect, but a lot of people are kind of creating this hyper dilute, whether mixing it with saline and injecting it throughout the décolletage. I have seen it, in doing face and neck lift surgery. I have seen just about everything. I have seen layers of this in the neck previously. People kind of tried to biostimulate, trying to create collagen in the neck, people putting it all throughout the face at a very hyper dilute way. I've personally never injected it a lot like that, but that's out there. And then PMMA, Bellafill, which is polymethyl methacrylate, which is a tiny little plastic bead. There is a lot of data out on this. It's actually 5 and even 12-year monitored data. But again, people aren't using this as much as a biostimulator, but in effect it is. The body is creating a small little foreign body reaction around each of these little particles. It is actually not dissolvable. It is permanent, and people use it. Again, that's not a product that we use in our office, but it's important to just kind of talk about the entire
portfolio.
Does that affect the way you perform facelifts when you come across a patient that's had Bellafill?
Takes a lot longer.
Yeah, I mean, it's a little bit different. We'll talk about how that has kind of affected my surgical practice. I think there's been patients who, I mean, I've seen patients just recently within the past 2 months, a patient who had Bellafill actually injected into the under eyes, and she wanted it cut out, like into the tear trough, periocular area. And it's just injected at so many different planes, you can't possibly take it out. Sometimes if you see a little nodule or something, you can take it out, but it's just very, very difficult. And so, yeah, I mean, we've seen all sorts of different things. We'll talk a little bit in a bit about how my feelings regarding, facial rejuvenation surgery and how the biostimulators work. So, Lily, tell me a little bit about, Sculptra now. Patient comes in, you consult with them, and they're on board with this idea of facial rejuvenation 401k program. Wow, Lily, this sounds great. Like, sign me up.
Yeah.
What other kind of information do you have to give them? Like, is it one and done? Like, how many times are they coming back? How long is this going to last them?
So normally I tell them that they're going to need at least a series of 2 treatments. So that'll be about 6 to 8 weeks apart. Normally we say about two vials per treatment, but normally we go about a vial per decade. So it could be like, for me, I'm 33. So I could, if I was a candidate, do maybe 2 to 3 vials, depending on how many how many vials I needed, what my face looked like. But normally you're going to do about 2 vials per treatment.
I always say it's good to do about 2 vials per treatment.
Yeah.
And if you want to do 3 vials because you're in your 30s, I would do 2 vials and then 6 to 10 weeks later. I usually say not sooner than 4 weeks, not later than 10 weeks. And collagen starts stimulating around that 6-week time period. And to get them back in around 6 weeks is always good because you're kind of hitting that upswing and they're just beginning to see that little glow to their skin. And then maybe do that 3rd vial separately on the next treatment time.
Yeah. And normally, like I know Sarah normally says 2 vials per treatment, and they come back for their for 2 more vials. And then it can last up to 2 years, but it's your own collagen production. So you don't want to say it's permanent, but it's as permanent can be when it's your collagen production. But normally we recommend them coming back once a year just for a maintenance treatment too, just to kind of keep up with their results.
Yeah, I mean, that's super, super important. And actually, if you look at the original trials,
was it 23 months?
It was 25 months. It wasn't even done by Galderma. It was done when it was approved in 2019. Interestingly, Sculptra was initially approved in 2004 for HIV lipoatrophy patients, and it wasn't really even the disease, but the medicines they were taking was causing so much facial volume loss in these patients. They were like, you looked at them and they were gaunt and hollow. And so they were going out and getting this product, and it was approved back in 2004 for HIV lipoatrophy. Now, the product was mixed up with, water at a very different concentration than it is now. But in 2009, it actually got its aesthetic indication. And if you look at those initial trials, they stopped the trial at 25 months. That was a long aesthetic trial, right? Over 2 years. And they're like, but if you look, and it actually went up against collagen, which was, the collagen went away quickly. But the interesting thing is, if you look at the trajectory of the graph, it's not like it was going down at the end of 2 years. It was still going.
Yeah, it's where the study ended because the study was just too damn expensive.
It was a long and expensive study, and they stopped it. But the trajectory was still, and I have patients, injected with Sculptra years prior, and then they come in, they get their 2-3 treatments, and then I don't see them for 3 years, and then they're like, what was that stuff you injected in my face? And I was like, oh, the Sculptra. And they're like, and I look at the pictures now versus 3 years ago, and it's like it keeps going.
Yeah.
But I like to see them back every year, as you guys are saying, because to get them to where they want and then to wait 2 years and then have to get them back up there. Yeah. Everyone basically that comes in your office to see you for an aesthetic treatment can come in once a year.
Yeah.
And, it's like a booster shot now that's like after COVID vaccines and that shot, and like the idea of like a booster shot, it's a little different now than it was back then. But, I used to have patients come in and they're like, okay, I want my Sculptra booster. And they would come in every year and get their once a year treatment, and you're just staying at equilibrium then, right? You're just kind of staying here rather than waiting the 2 years and waiting to get to where you want.
So moral of the story is we really don't know how long the effects actually last.
I think the effects continue.
Yeah, correct.
And it's interesting because kind of a new topic that's come out is this idea of like the Sculptra glow.
Yes.
And years ago, actually, I was at it was in 2015. I was in Vienna, Austria, and I represented the U.S. with Shino Bay Aguilera, and we were the 2 U.S. Representatives for a global Sculptra advisory board. It was really interesting at that time because 2015, it was funny because Shino and I were injecting it in the face and we were talking about our experiences, and like all the Brazilians and the Taiwanese and they were all talking. They're like, you guys inject, and there were a lot of dermatologists and plastic surgeons, and they're like, you guys inject Sculptra in the face? It was like they were doing off face and body treatments way before. And it was really, really amazing to see what they were doing ex-US before, it certainly hasn't been approved for that. I think there are some, in the works, some body treatments to come in the future with an FDA approval, hopefully. But the interesting thing is at that time, one of the things that everyone recognized, whether it was on body or face, was this kind of like glowy appearance that the skin gets, right? Mm-hmm. You're creating collagen deep, whether you're in the skin or you're deeper, and you're creating this kind of like positive collagen, improvement. Where does that go? It has to go outward. It has to go to the skin. Mm-hmm. So Galderma actually did the study, and they looked at it, and they looked at the skin radiance, and they showed that it was improved after using Sculptra in the cheeks, in the cheek wrinkles. And so that was one thing that came out of this meeting, was we need to find a way to quantify or to like talk about this glow that everyone sees, but we don't know how to like quantify it.
Sure.
Mm-hmm.
Yeah. I mean, you guys, I'm sure, see it in your patients. Mm-hmm. Right?
Just curious. I know you're a facial guy, but what is your thought on Sculptra and the butt? Since that was like a big thing when I first actually moved to Philadelphia in 2018. Everyone wanted a trainee on Sculptra and the butt.
Yeah, I mean, I've injected it. I've done like this kind of like BBL with Sculptra to try to like increase volume. It's probably, in my mind, it's probably more expensive than it's worth the result.
I agree. That's what I was.
You might as well
just
my
patients
get
too.
lipo and a fat transfer at that point, right?
The problem is not everyone has fat for a fat transfer. Yeah. So if they have the money and they're willing to spend such a significant amount on maybe a smaller improvement, fine, but it's like what you always say, you have to manage the expectation of it. I also think the Kardashians and the whole big rear end is ending. I think that trend is kind of had enough.
Yeah,
it's on its way out.
It's on its way out.
Moving towards more natural.
Yeah, like people who work out, people who do Pilates, people who do spin. That kind of body is back. I don't want to say that
my flat ass is in trend.
It's just I just think it's. With Ozempic and tirzepatide, Mounjaro, Zepbound, all these different drugs, people are thinner now too.
Yeah.
So
I mean, it's interesting. I also think the idea of like a Sculptra BBL is kind of ending, especially with the advent of, and I've never injected this yet, but certainly a lot of the plastic surgeons I know are trying out things like Alloclay, which is a newer injectable. It's basically like cadaveric fat that's getting injected. And so in large volumes, they have these large volume syringes now. So people are more experiencing, getting more experienced with that, where they can inject this kind of like fat product, and then the surrounding fat kind of gives it a blood supply. And so
cool.
For breast and body, it's been kind of interesting. And I think we'll see how that plays out in the next year or two as more experience is gained with that. Okay. But Sarah, now a patient comes, in your practice, who is the best candidates for Sculptra, and who do you kind of pump the brakes on and say, gosh, I wish I could do this, but maybe you're not the best person?
So who is the best candidate was the first question.
Yeah.
Okay. So the best candidate is someone who's looking for mild, subtle volume, someone who's looking to have global volume rejuvenation as opposed to fine-tuning a specific area. So
right. I say Sculptra is not a line filler.
Right. So people who say, I don't know what it is, but I don't quite feel like I look like myself anymore. So they've started to notice volume changes. They're not so far gone yet. So people who basically don't know how to put their finger on what they're looking for, but they know that something has changed. I think that's really the ideal candidate, who, someone who could be coached through the process and really be happy at the end.
And who wouldn't you use this product on?
So I know there's a lot of, I don't want to say controversy, but debate on can it be used in patients who have autoimmune diseases. So my personal opinion and my personal experience is I'm much more comfortable using Sculptra on a patient who has an autoimmune disease as long as it's controlled than I am using, say, a Vicross product. I have used Sculptra on people with autoimmune diseases. I have an autoimmune disease. I've had Sculptra many times. I've had no problem. As long as that person is controlled, as long as they're being well managed. I think people who have autoimmune diseases who are on biologics or, have other kind of help controlling their immune system sometimes are better managed than people who, aren't. But this is anecdotal. That's my personal opinion.
Yeah, I mean, I think as we said, Sculptra is a kind of a pro-inflammatory,
right?
You're creating a low-level inflammatory, process here. And so patients with pro-inflammatory disorders or diseases and things, I tend to use this product less. Like I'm not,
for sure.
If a patient has an autoimmune process, this is not what I'm recommending. I think there are, fillers that work well, maybe not some of the other fillers that tend to, cause a little bit more issue in my office, but we've kind of got rid of a lot of those, fillers. And so, the good thing is we understand a lot about how the fillers work and the makeup and how the manufacturing, the rheologies and the manufacturing, which all goes into our decision which is what we carry in our practice. And over the last 5 to 7 years, what I've carried in my practice has changed significantly. And what I have on the shelf now is nothing like what I used to have. And so, yeah, I mean, I think there are safe fillers to use in that population, but for me, I certainly am not injecting like a Sculptra on a patient with kind of a pro-inflammatory process.
I don't even know if we mentioned, like, for the audience that doesn't really know what suture material, I just said it. What Sculptra material is it's suture stitches broken down into powder form. So my question to you is, I've had a patient, and actually I never followed up with her. Sorry. She said that she would get allergic reactions when she had sutures. And I don't know the type of sutures. Would that give you pause in doing Sculptra in a patient like that?
Certainly. So Sculptra is poly-L-lactic acid, commonly used like in every facelift I do. I use a suture that's called Vicryl, which is made up of the same thing. And I have seen, like in my 15-year career of surgery, I have seen 2 kind of patients with more of kind of maybe an allergic reaction to like a Vicryl suture. It's a little bit more pro-inflammatory. One of the reasons why we like it is it's a braided suture and you can kind of tie things down nicely with it. And so, yeah, if certainly there are sutures for the skin, like Prolene and nylon, which are taken out, which are purposely inert and don't cause a lot of inflammation. But if someone, presents with an allergy to some of the deeper suture material, yeah, maybe that's something to look at. So yeah, it's basically a micronized Vicryl suture into a powder that we mix up with essentially water and inject it throughout the face. So Sarah, tell me, because we work together a lot and you do a lot of the injectables in our office and I do certainly a lot of facial surgery, but let's say a patient comes to you and they've been seeing you for a while and they're like, I don't know what to do. I'm really considering, getting this idea of Sculptra. I like what you're telling me about it, but, I know that I'm going to want a facelift in the future. What do you say to a patient like that?
So the first thing I tell them is Dr. Bloom's probably operating on someone right now who has had Sculptra.
Probably true.
I mean, the amount of people, the amount of patients who either you've injected with Sculptra, I've injected with Sculptra. I mean, the goal is to eventually move all of them to surgery if they want it.
Sure.
So there would be no point in me messing up their overall surgical experience. I mean, it wouldn't be worth it to me. It wouldn't be worth it to you. But what I really touch on is the plane that we're injecting Sculptra in. So everyone talks about deep plane facelifts, but nobody actually really knows what it means if they're not in the industry. So basically, I just tell them, we have superficial layers, we have deeper layers. And I'm going to be working on that superficial layer, and Dr. Bloom, when he eventually does do your facelift, is going to be beneath it. So we're not going to have any issues there.
Yeah, that's very similar to what I tell my patients, because when, right now, this is a time where there's a lot of, unfortunately, fear-mongering going on there, saying you shouldn't get Sculptra, you shouldn't get energy-based treatments. And what's happening is that is pushing the younger patient, my age patients, right, in their mid-40s, to getting facial surgery when they can be treated with filler,
sure,
conservatively, some energy-based treatments, Sculptra. And personally, because I do a lot of this, I'm doing about 100 face neck lifts a year. And what I'm seeing is I personally would rather operate on a patient who's had Sculptra in their face or an energy-based treatment than someone who's had a poorly done face neck lift where the planes are obliterated, where the tissue isn't where we initially thought it was going to be. And, there's a ton of scar tissue.
Yeah.
And so by someone who's forced into early surgery and then I'm doing revision surgery on, I'm seeing a lot more truly scar tissue than I am as if they were having, Sculptra in their face. Now, this idea of plane is really important because in my mind, Sculptra should be injected at one of two planes. Number one, superficial subcutaneous plane. That's underneath the dermis, got that dermal subcutaneous junction. And areas where we inject that are in front of the ear. You can inject that all in that submalar area here, cross-hatching it. It works very well in that plane. Additionally, you can inject it on bone. Supraperiosteal, right? In the temple, in the midface if you want, in the piriform. Areas like that, those are not operative planes for me. When I'm doing a deep plane facelift, I am raising up the skin from right in front of the ear to about maybe an inch in front of it. There's no problem with going through the superficial tissue here. You're not reaching a lot of basically, scarring. What happens is people are seeing who maybe aren't injected by us, and they're injecting it into the fat pads and into the deep plane and things. And yes, I have seen a few patients, and I probably can count on them in one hand this year who I've seen, but it is maybe a little bit stickier in that deep plane. But if someone comes to me and it's like, oh, I was injected by Sculptra with this person, am I going to say to them, nah, I'm sorry, I'm not going to do your facelift? No, we don't get to choose our patients like that. I'm going to say, well, listen, I'm going to do the surgery that I do. It might be a little bit more sticky or hard for me to do that. But when I know that the patient is coming from you guys and you have injected the patients, I feel comfortable that the right plane, the product was injected in the right plane. So that's really important. And additionally, this idea of Sculptra causes scar tissue, I think that's a huge misconception. There is great data out there that was done that showed that over you're getting the majority of the collagen that is created with PLLA is type 1 collagen. That is not scar tissue.
Right.
Okay.
Scar tissue is
like type 3.
Right.
And so initially with any kind of like wound healing process, there's a small amount of type 3 collagen, but overwhelmingly, and this has been played out in the literature and in actual studies, shows that a vast majority of the collagen that is, I mean, this is done through biopsies and, actually evaluation of the collagen. It shows is the vast majority is type 1 collagen. This is not scar tissue.
Yeah.
Now, like I said, I've seen cases where it is definitely a little bit more sticky when I'm dissecting some of the deeper planes. But in general, if you're staying to the superficial subcutaneous plane or on the periosteum, I'm not doing a periosteal facelift. I'm not doing a skin-only facelift.
Yeah.
Those are planes that I'm not typically in. So they're so far away from the area I'm injecting. I think a lot of the people who are just doing such high volume, facelift surgery, we don't know where our patients were injected.
Sure,
And
yeah.
I think that we've all seen those cases where we're like, oh man, this is a little bit harder of a dissection than I was used to, but we have to be ready for that.
Yeah.
I wouldn't tell a patient no. If they're a good candidate for surgery otherwise, and they've had a product like this, I'm not turning them away just for that.
Yeah,
Yeah.
makes sense.
Yeah.
You seem very passionate about
Yes.
this subject.
That was great information.
Well, it's something I experience all the time.
Yeah.
But I feel
know?
like we hear a lot about that, and there's
Yeah.
a lot of debate about it, and I think that people just need the right education.
Again, you see it on social media. There
Yeah.
are other plastic surgeons that are very against Sculptra.
Yeah.
So
I mean,
nice
if you
to
see
hear
me
the-
kind of swearing because I'm having a bad day in the operating room because
I
it's
know
a lot
why.
tougher than normal, it's usually not because of its Sculptra. It's
Yeah.
because of the patient had a previous facelift surgery that kind of went wrong,
Yeah.
a year or two before, and now they're seeing me for a revision. And I can just tell you it's not as easy. It's not as easy. There's so much more scar tissue, true scar tissue,
Yeah.
Sure.
that you see in that case than in, a case of, with some injectables.
Mhm.
Yeah.
One question for you, Dr. Bloom, because I've actually never asked you this. Your double board ENT facial plastic surgery, if you hadn't gone to that specialty, what specialty would you have chosen?
Interestingly, when I was in medical school, I mean, this is like a question I get all the time. And like when I was in medical school, I was actually like gung-ho neurosurgery. And I love the idea of the brain. And it was called biopsychology and cognitive science. That was actually my major in college. And I was actually a history of art minor. So right now, actually, I do art and science, which is like kind of combines what I, learned in college. I love that idea. And so right now I love what I'm doing, but I was gung-ho neuroscience, and this idea of operating on the brain was so amazing. And I wanted to do something called functional neurosurgery, which is where patients are awake and they're having craniotomies.
Oh,
And they'll read a passage from a book, and to make sure that they're avoiding certain areas of the brain. It was like, you see this there. I remember when I was at University of Michigan in medical school, and I was watching this guy operate, and it was like mind blowing. I'm like, I want to do that. That is the coolest thing ever. Until I did, towards the end of my third year of medical school, I did the actual neurosurgery rotation. And I remember this guy who was the chairman of neurosurgery at University of Michigan. And I love this story because I just remember sitting in his office. His name was Julian Hoff, and he went by like Buzz. That was his name. And he's since passed away, and he was like a legend in neurosurgery. And he sat me down and he's like, Jason, you're doing a great job on the service. I was like doing that elective neurosurgery. And he's like, tell me about your ego. And I said, what do you mean? And he said, Well, in order to be a neurosurgeon, and he was such a mild-mannered guy and very humble, and he said, you kind of have to have a big ego, not in the sense that you need to be boastful and proud, but you need to know that as a neurosurgeon, patients are going to die despite your best effort. He said, never has there been a neurosurgeon that a patient hasn't died on their table, that hasn't died under their care. And for some people, you operate on these people, and then you have to go and talk to the families, to the loved ones of these people who just had a family member die, and talk to the grieving families, and then get back in the operating room and do it and try to save the next patient.
Yeah, that's really hard.
And when I hear that, I am super soft, and I'm just like, I didn't want that for my life. Yeah. Like, I wouldn't be able to handle it. I've never, God forbid, had a patient die or have like a traumatic event like that. I don't know if I would be able to continue. And you almost have to be robotic. And what he meant by the sense that you have to have a big ego was you have to know that you did the best you can, and you're the best at what you can do, because you have to be proud enough of yourself in order to move on.
Yeah.
And if you're not, you can't do that. And that kind of moved me to a whole nother, I'm like, I just can't do this. But I still love the head and neck anatomy, which kind of drove me to this, ENT, facial plastics, facial reconstruction. That I loved that. But that kind of was a huge moment in my life and my career, and changed me from, doing one thing and kind of being, because when you're in medical school, you're just like, this is awesome. This is what I want to do. I want to operate on the brain. And then when you actually think about it, you don't get that sense to like step away and have that moment to think about it with like all the things that actually go into it.
Yeah.
And like the side that, you don't want to have to do. So, so that changed my career, certainly I think for the better. But
yeah.
And isn't that crazy that moment changed all 4 of our lives?
Yeah.
A little
and
bit.
here we are
I mean,
doing a podcast.
It really did. I mean, that, like, I have chills right now. That's the kind of thing that happened in someone's life that just...
It's like sliding doors, right? If I didn't do that.
Like, none of us would be sitting here if you hadn't had that come to Jesus moment.
Yeah, totally.
Come to Moses, but yes.
I was about to say, sorry, guys.
Okay, so let's close this episode. Thank you to everyone who kind of listened in today to this podcast episode of Beauty and Bloom, talking about biostimulators and Sculptra. It's been awesome having my team of nurse experts today. Thank you guys for being here. But please make sure you listen in, subscribe, and share the content. And I hope you enjoyed all the things you've heard today. And remember, let your beauty bloom.